Welcome to PEDS Musculoskeletal Disorders Part 1. This first section is going to be an overview of general principles regarding care of the child with a musculoskeletal injury. The remainder of the video lectures are going to address specific problems that children acquire either congenitally or with their development. Things we need to keep in mind in regards to a child who has an injury related to the musculoskeletal system is that any injury has the potential to alter normal development. It can affect the growth of the bone because the epiphyseal plate is disrupted. It limits their use of that extremity, and it can ultimately adversely impact their ability to walk, run, jump, participate in activities, etc. Remember that the epiphyseal plate is responsible for bone growth. It gives the bone its length, and it is active throughout childhood, but it's particularly active during adolescence, and it stops at the very late period of adolescence. Also keep in mind that children's bones are softer, and they're less likely to fracture as a result. And when it does fracture, it isn't a snap like you or I would have. What they have is what we call a green stick fracture or a bucket handle fracture, because the bone almost collapses on itself and we just see a small blip where part of the bone has folded on itself. Here's a nice picture of the anatomy of the bone for your review, and look to see where that epiphyseal growth plate is. It's at the proximal end of the epiphysis. And then we have the typical long part of the bone that contains the periosteum as well as the marrow where our blood cells are developed. And then we have the metaphysis. Any area of this bone is subject to injury from trauma or some congenital anomalies or acquired anomalies. So what are our issues in regards to immobilization? Well, as with anyone, if we don't use it, the muscles become weak. The longer we don't use it, the more they become atrophic. In the long run, we can end up with loss or failure to ever achieve the developmental milestones, and this is going to affect their growth as well as their fine motor movement. In the long run, immobility affects demineralization of the bone. We see this in our special needs children who have severe mental impairment and cerebral palsy. Their bones demineralize, so they will have early osteoporosis. You should know that immobilization can decrease mobility of joints and cause contractures. And then we have other issues that are very similar to our adults. Altered circulation, they're at risk for a DVT. If they're not moving, they're laying on a certain area of their body, the skin pressure can ultimately result in breakdown. Because they're not up and moving around, they're not breathing as deeply, they can get a pneumonia. It can alter the peristalsis in the gut and cause constipation. So this is a mobility issue, and it may be related to their pain medications. They can have muscle weakness, they can have altered nutrition, altered growth and development, and because a children's job in life is to play, they become bored and they need some type of diversion. Let's review how to take care of a child with a cast. You need to do CMS, circulation, motor, sensory. And you should be able to differentiate that from doing a neurologic check when we're doing sensory assessment and motor assessment. It's a little bit different. So we're feeling the temperature of the extremity. If there's a pulse that's below the injury, we're going to assess it. We look at the color. We see if the child can move it and can they feel it. What is the cap refill like? Is it brisk the way it's supposed to be, or is it delayed? Any alteration in these assessments need to be reported to the physician and must be documented in the medical record. You should be familiar with the 5 Ps, assessing for pain, pallor, paresthesia, pulselessness, and paralysis. And what is that parallel with? The CMS checks. If you find an abnormality, you need to quickly reassess and do some type of nursing intervention when you find an abnormal finding in order to prevent long-term tissue damage. Cast care, same thing. do CMS assessments. You want to avoid pressure and friction. So when they have a cast, you should elevate it on a pillow, especially as this cast is drying, so that they don't develop a pressure point just from laying on a hard bed. We can apply ice, and this will reduce the swelling after an injury, and then we also elevate it. It's more common for us to simply elevate the extremity than it is to apply ice. And you need to reposition this child frequently, especially when they have a new cast. And then, of course, implement all of the nursing interventions related to immobility. This picture shows the heel of an infant that is showing skin breakdown. And this is only the beginning. Now we have the erythema, but you see that central area? That has the potential to become completely necrotic. So what happened? This child wasn't moved. Cast may have been on too tight. We didn't pay attention to the sole of the foot. We only palpated the top of the foot and didn't realize that the child had pressure and wasn't perfusing to this area. This is going to delay treatment. So the next several slides are going to show you a variety of casts that you'll see on children. This is a hip spica cast, and we use this to correct hip dysplasia. And there's a completely separate video about hip dysplasia, but when we have to do this, it means that our conservative measures did not work. Look at all these pictures. The top picture, I want you to imagine what it's going to be like to pick that child up. So he looks like he's about 3 or 4 years old, so he's going to be heavy to begin with, 30, 35, maybe even 40 pounds. That's hard to lift up. And when you see the cast in and of itself is heavy, and this child can't help you when you pick them up. So this is going to be part of your teaching points to the parents. How do they get this child from the bed to the chair, to the wagon, to the car seat, and buckled in safely and without harming themselves? But you can see on the picture on the left how they are moving this child around in a buggy, even sharing with his baby sister, and then being outside participating in activities. Look at that long stick as they're roasting marshmallows. So he's propped up on a pillow and he's not even close to harm with that fire. Here are other examples of casts, very common. They break their leg, they break their arm. And here's Michelle Wolf's child. He broke his leg, and you can see how it didn't stop him from participating in scouting activities. So this ends part 1 of musculoskeletal disorders.